Beyond the numbers. Why weight loss may be more critical than A1C for type 2 diabetes control for decades. The A1C test has been the primary yardstick for managing type 2 diabetes, T2D. While this blood test remains a vital tool, medical experts are increasingly shifting their focus from merely managing symptoms to addressing the root causes of the disease. The emerging consensus is clear. While A1C tells you what is happening in your bloodstream, weight loss explains why it is happening and offers a path toward actual disease remission. The limitation of the A1C gold standard. The A1C test measures your average blood glucose levels over the previous 3 months. It is an essential diagnostic marker used by doctors to evaluate how well a diabetes management plan is working. However, relying solely on this metric has its pitfalls. It tracks symptoms, not causes. A1C shows how much sugar is circulating, but it does not reveal the underlying pathology driving the high glucose levels. It lacks real-time nuance. Because it is a 3-month average, it cannot capture the immediate impact of specific meals, physical activity, or sudden medication changes. This is why many providers are moving toward continuous glucose monitoring, CGM, for more granular data. How weight loss targets the root cause. To understand why weight loss is so transformative, one must look at where fat is stored. Type 2 diabetes is deeply linked to excess fat in 3 specific areas: the liver, the pancreas, and the abdominal region, visceral fat. Reducing inflammation. Visceral fat, the fat surrounding your internal organs, acts as a source of inflammatory molecules. This inflammation is a primary driver of insulin resistance, the hallmark of type 2 diabetes. Restoring organ function. Excess fat in the liver can eventually migrate to the pancreas. When the pancreas becomes fatty, it disrupts the beta cells responsible for producing insulin. The remission window. Research suggests that losing 10% to 15% of total body weight can reduce fat in these organs, potentially allowing beta cells to recover their function. Early intervention matters. This process is most effective when addressed early in the disease progression. Meaningful weight loss can do more than just improve glucose numbers, says Dr. Najat Chalisa of Morris Hospital and Healthcare Center. In some people, it can actually modify the course of disease. The normal weight factor. Interestingly, weight loss isn't just for those with high BMIs. Small studies have shown that even individuals at the threshold of a normal weight BMI of 25 can achieve remission through structured, low-calorie dietary interventions that reduce organ fat. Note, weight loss strategies should always be medically supervised to avoid becoming underweight. The role of GLP-1 medications. The landscape of diabetes treatment is changing with the rise of GLP-1 receptor agonists. These medications serve a dual purpose, acting as a bridge between glucose control and weight management by suppressing appetite and increasing feelings of fullness, slowing gastric emptying, regulating insulin secretion from the pancreas. While these are often prescribed when standard medications like metformin fail to meet A1C targets, experts suggest that patients do not necessarily need to fail older treatments before discussing these newer, weight-targeting therapies with their doctors. Summary: a shift in strategy. The goal of diabetes management is moving from maintenance to remission. While A1C remains a necessary tool for monitoring blood sugar, focusing on weight loss addresses the biological drivers of the disease, specifically inflammation and organ fat. The bottom line: addressing weight and metabolic health early, even in the pre-diabetic stages, one of the most effective ways to prevent long-term complications like kidney disease, nerve damage, and cardiovascular issues, ultimately improving both the quality and duration of life.